Hello, everyone. Thank you for joining our webinar. My name is Mohammed Caleb, Senior Manager, Comprehensive Cancer Control at GW Cancer Center. Our webinar is titled, Using Social Network Analysis to Measure Coalition Collaboration, a Case of Community Roundtables. I would like to thank and acknowledge the support from CDC for this work. Without further ado, I'd like to introduce Kanako Kashima. Kanako Kashima formerly worked at the GW Cancer Center, where she led the planning, implementation, and evaluation of multiple capacity building projects for national comprehensive cancer control programs and coalitions. Currently, Kanako is a Director of Health Equity Community Projects at the American Cancer Society, where she's leading the development of community leadership teams across the country charged with tackling health equity issues within their organizations and communities. Kanako, the floor is yours.
Thank you, Mohammed and GW Cancer Center, for having me today to present on using social network analysis to measure coalition collaboration. And I will be using the Community Roundtables as a case study. By the end of the presentation, you will be able to define social network analysis and describe ways to use social network analysis to monitor the development of relationships and improve program delivery. So what is a social network? A network is a set of nodes or individuals or organizations denoted by the black circle with a set of ties or social relations that link them, and those are denoted by the arrows. So to put it another way, social network analysis is the study of these social relations among a set of individuals or organizations. Just as a disclaimer, I am not a social network analysis expert or researcher, but a practitioner. I have experience applying social network analysis in public health, and I attended a workshop a couple of years ago, organized this man on your screen called Steve Borgatti, and he's at the University of Kentucky and is an industry leader in social network analysis research. So at this point, I would like to show 2 minutes of this video from University of Kentucky, in which Dr. Borgatti briefly outlines the study of social networks and its significance. I will say I'm sorry in advance if the audio isn't great, but GW Cancer Center will be distributing the slides after the webinar, so you can access the link from there.
About the world around you, you kind of have to learn something about networks. They sort of act like pipes, and through a network, things can flow from person to person, particularly in organizations, which is what I study. It's how things get done. It's how work gets done. It's how we coordinate, the 370,000 people that work for IBM. How do they all work together to get something done? It's through formal and informal networks. I mostly study centrality, which is the concept of the advantage that accrues to a node by virtue of its position in the network. So some nodes are more central, and there are certain advantages to that. So, for example, one way in which you could be central is that you're not far from everybody else in the network. There are few steps in between. People like that tend to hear things faster. So if the information is flowing through them, they hear it early when they can take advantage of it. One of the things that central people have is that they're connected to lots of different parts of the network. And this part over here is talking about certain things, and this part is talking about certain things. And the person that happens to be connected to both can realize that the problem that they've got has already been solved by that group, and they can really provide a lot of value.
Great, and I hope that video starts to get you into the idea of the study of social network analysis, the different players that are in place in terms of the nodes and the various ties that influence those nodes. There are some basic assumptions of social network analysis that we should take into account. And these assumptions can also be limits to social network analysis, because if these assumptions do not hold up for various reasons that may be unique to the circumstances you are trying to assess, your results may be less meaningful. So one assumption is the influence of kinship. Being a mother of somebody or being a husband of somebody will have an influence on what your relationship is like with your counterpart in terms of the type of kinship you have. Roles also matter between bosses and the supervisees, or a teacher and a student. There are also perceptual differences and influences between nodes. Like if you know somebody or if you know the name of somebody but may not necessarily have interacted with them in person, your relationship type would be different from somebody who works day-to-day with a colleague, for example. There are affective differences, so whether you like a person or whether you trust a person will be different depending on the types of relationships you have with somebody. And there are interactive differences, so maybe you give advice to certain people but not others, or receive funding from certain grantees but not others, and work with different individuals within your organization but not others. And there are also different types of affiliations that influence who you work with and the types of relationships you have with them. So you could be in the same organization and working together, or you could be by association of geography working together as well. And there are other assumptions are things like the fact that ideas and materials flow through these relationships and that these structures of relationships have some consequences. So as you can see, historically, social network analysis has been used to leverage some of these assumptions to assess the spread of infectious diseases. So, for example, some researchers have used social network analysis to determine the hubs and the kinds of relationships that promote injection drug use or the spread of HIV. But social network analysis is being used more and more recently to assess changes in organizational structures and collaborative.
Let's say that this is a coalition made up of 3 different organizations, and you can see A, B, and C in these different colors on the nose on this map. And this map was created by asking the question, who do you send relevant information to? And you can see the organization members send and receive information from each other by looking at the direction of the arrows. So you can see here AS sends information and communicates with TB. So as you can see, member AS from organization A sends information to TB, but TB does not send information to AS, so it's not a bidirectional relationship. You can also see that members of organization A in general, so the nose in red, do not communicate with each other through this network at all, because you can see AS has no ties to JT over here. And neither of them are connected to any of the other organizational members. They have some communication channels here, but these folks are not connected to JT or AS, and they supposedly work in the same organization. So this may lead you to conclude that AS or JT should not be coalition representatives for organization A, and that you need to create a more targeted individual approach to sending the news and information of the coalition to AS and JT. On the other hand, you can see organization C in green right here are very well connected, and they're a very tight network because they send information to each other very well and receive information from each other. And this is an example of what they call a complete network because each member in organization C is in contact with the rest of the members in organization C. So from this information, you might conclude that you only need to tell one member in organization C news or information, technical assistance, and training, for you to be assured that the rest of the organization will also be in the know, and that you don't need to communicate with each individual independently. This social network map can also be used to assess who you should interview when you are conducting needs assessments or coalition evaluation. So for example, JB from organization A, TD from organization B, and PW and BD from organization C might be good key informants to ask about factors that facilitate information sharing. So you can leverage those people and factors more in the future. And you might also interview JT over here in organization A, who receives information from TD, but nobody else in the coalition, about barriers to communication, and you can also ask this person about maybe ways and suggestions to make communication easier so that this person can be better integrated into the coalition. So in this way, social network analysis can be helpful for program or coalition planning, evaluation, and improvement. And GW Cancer Center chose to assess connections on an individual level instead of what is shown in this graph, which is an assessment on the organizational level. So as a part of this cooperative agreement, we organized community roundtables with the goal of convening key cancer and chronic disease stakeholders and strengthening those partnerships at the community, state, or regional level to promote increased integration efforts between the two groups. This was in response to CDC's observation and direction for more cancer control programs and coalitions to collaborate with each other and through their chronic disease peers to reduce duplicative effort, save resources, and ultimately advance the mission. And of course, it makes sense to increase collaboration between the stakeholders working on cancer issues and other chronic disease issues because we know that they share common risk factors, as this graph from Alexa's Department of Health and Social Services really nicely shows. Our hope was that the roundtable meetings would provide stakeholders an opportunity to share their work, find overlapping goals, and work together on mutually beneficial initiatives because after all, we know that collaboration saves time and precious resources. So we chose to work through the area health education centers. There are more than 300 area health education centers, or AHECs, across the country, and they work to enhance access to care by improving the supply and distribution of healthcare professionals. And GW Cancer Center decided that AHECs were ideal agents to bring cancer and chronic disease stakeholders together because of their community-level connections. And we also found in a cancer control needs assessment that we conducted in 2013 that the AHEC representatives we interviewed said they were neutral or were not at all engaged in comprehensive cancer control activities. So we saw a need for making those connections right off the bat. And ultimately, 4 AHECs were chosen by GW Cancer Center through a competitive application process to host 3 roundtables because of their strong community-level history and connections. This map shows the location of the 4 AHECs, and they were in South Dakota, Vermont, Kentucky, and Florida. They represent 4 different regions in CDC's National Center for Chronic Disease Prevention and Health Promotion region. Each community roundtable was organized to convene once a year between 2015 and 2017. And they were all in person, and we also organized a 6-month follow-up call each year online. The AHECs, along with the planning committees, selected one chronic disease risk factor that remained constant throughout these 3 years, and those are listed on the left-hand side, and one strategy that changed each year to advance cancer and chronic disease integration efforts in a comprehensive way. And these chronic disease risk factors and strategies were informed by national and local data compiled in state profiles by GW Cancer Center, as well as national priorities and windows of opportunity. And you can read more about this GW Cancer Center resource called State Cancer Plan Priority Alignment Resource Guide and Tool by clicking on the bit.ly or visiting that bit.ly on your own. So to evaluate the Roundtable initiative, we administered standard pre- and post-meeting surveys that assessed process outcomes and satisfaction, which is fairly easy to do. But because the goal of the Roundtable is to convene key stakeholders in cancer and chronic disease silos and strengthen relationships at the community, state, and regional levels to promote increased integration efforts, we wanted to dedicate more time measuring that collaboration itself. So we have received questions about how cancer control coalitions could measure coalition collaboration as well, and I think that what we've learned through our initiative through the Community Roundtables is very applicable for measuring coalition collaboration. So here's the type of survey we created for each roundtable attendee at each of the 4 roundtable locations to complete. On average, the roundtables had about 20 to 30 people in attendance, so the number of rows in this matrix was much, much longer. We needed each attendee we asked each attendee about all of the other attendees, so how they know them, if they know them at all, how often they contact them, how often they send and receive information or technical assistance to or from them, and how much they trust them. So as you can probably tell, having each attendee complete this matrix of 20 to 30 people can take time, which is one of the challenges of collecting social network analysis data. And another challenge to keep in mind is the completeness of data. Good social network analysis heavily depends on high completion rates, which is something to keep in mind as you consider employing social network analysis to evaluate your cancer control coalition. So I just thought I would give you a fun example. Let's say Harry Potter is completing the social network analysis survey that was created to assess the network of students at the Hogwarts School of Witchcraft and Wizardry. He would leave the first word blank because we're not interested in him evaluating himself. But the second row is asking him to evaluate his relationship with Hermione Granger. And Hermione is Harry's best friend, so he would indicate her as being personal friends. They live in the same dormitory and share every aspect of school life together, so Harry would indicate that he and Hermione have contact and exchange information every day. And he would also indicate that he has a high level of trust in her. On the other hand, Draco Malfoy, who's on the next step down, is a school bully, and Harry would know him as a lab partner and might have weekly or so contact with him, but he may not share or receive school secrets and gossip with him, and he certainly wouldn't have a very high level of trust in Draco. So in this way, each network member will complete the same survey and assess their relationship with all the members of that network, and the questions can be adjusted depending on the type of information you want to collect. And so we employed this strategy specifically when we assessed the Community Roundtable. So the Roundtable participants in 4 states, again, Kentucky, Vermont, Florida, and South Dakota, completed the online surveys before the Roundtables in 2015, 2016, and 2017. We used a software called UCINet, a social network analysis software, to assess the networks and working relationships and any changes that happen in between each meeting. So let's take a look at Northeast Kentucky first. Northeast Kentucky Cancer and Chronic Disease professionals met to tackle common health objectives to do with tobacco, and the region is highlighted in yellow on the map. As you know, cancer professionals have a stake in tobacco use as it causes a number of different types of cancers, including lung, colon, and cervical cancers. Chronic disease professionals in general also have a stake in tobacco, as its use has been linked to a myriad of diseases, including heart diseases, asthma, and dental diseases. And Roundtable attendees identified activities that integrate cancer and chronic disease interests and committed to work on them together. So here's the summary of what they achieved by the end of 2017. The Northeast Kentucky Community Roundtable identified and incorporated local and national smoking cessation resources in St. Clair Regional Medical Center's electronic medical records. So providers can easily refer patients to smoking cessation resources. They also developed and pilot tested the Breathe Tobacco Treatment Specialist Training, which provides 27 hours of online training and includes content consistent with core competencies established by the Association for the Treatment of Tobacco Use and Dependence. These are great outcomes from simply getting a group of cancer and chronic disease professionals to communicate and to work with one another, but how is this reflected in the social network? And take a look. So here are the social network maps of how often they communicate. The nodes or the roundtable members are the squares, and the relationship that is denoted as ties connecting the nodes. So the thicker the line, the more frequently they reported communicating with one another. The blue nodes are cancer professionals, the yellow are chronic disease professionals, gray said neither, and white did not answer that specific question. So just by eyeballing the maps from 2015, 2016, and 2017, in this case, you can't really hone in on the developments of the relationship. Although the network in 2017 does notably appear smaller because we have the lowest completion rates out of the 3 years. So let's have a look at the data. Kentucky started with a very strong network, and in fact, it was the strongest of all the 4 roundtables that we held. It helped that the APEC was convened the meeting, and they were very well respected and already integrated as a part of the regional hospital and frequently partnered with academics as well. The average degree indicator, which is the first indicator displayed here, tells us that the person on average knew approximately 7 other people at the roundtable in 2015, and this number went down to 5 by 2017, but this is expected to a certain extent. As new members interested in the initiative who may not have been well connected initially are brought in between the first and second roundtable. So for example, as the issue of e-cigarettes became more prevalent and concerns over their health consequences increased, Kentucky decided to widen scope beyond just tobacco and bring on subject matter experts in e-cigarettes as well. So as these new lines came in to be a part of the new network, they likely had an effect on numbers like the average degree indicator. And similarly, average distance between the participants also increased, which means that on average, the number of hops people will have to make to get from person A to person B or to get connected to them increased. So actually here, the smaller the number, the better. Again, this is likely due to new members being added to the roundtable who may not have been well connected initially. So both average degree and distance indicators told us that the challenge for Kentucky would have been to strengthen those new relationships. But as you can see, diode reciprocity increased from 12% in 2015 to 30% in 2017. So this means communication between participants became increasingly more reciprocal and that the conversations were materializing in a back and forth manner, and it wasn't just a one-way communication. So let's look at the roundtable in Vermont. And the attendees there renamed their roundtable as the Champlain Valley Healthy Lifestyle Collaborative. And as the name suggests, this roundtable chose nutrition and physical activity as a topic, and their region is highlighted in yellow on the map. And as we know, again, cancer professionals have a stake in promoting nutrition and physical activity because it causes a number of different types of cancers, including endometrial and colon cancers. And chronic disease professionals also have a stake in promoting nutrition and physical activity, as its use has been linked to heart disease, diabetes, and stroke. So the roundtable attendees identified activities that integrate cancer and chronic disease interests. So the Champlain Valley Healthy Lifestyle Collaborative partnered with Vermont's Department of Health to amplify and increase the reach of the 3-4-50 communication campaign that increases awareness of the benefits of physical activity and good nutrition to prevent chronic diseases. The roundtable also identified a small to medium-sized employer and obtained commitment from them to incorporate 3-4-50 as part of their worksite wellness initiative. So again, these are promising outcomes, but let's look at how it's reflected in the network. So here's the social network mapped again for Vermont. And from eyeballing the maps, you can tell that the chronic disease professionals in yellow are better integrated in the network in 2016 compared to 2015. But the network size, again, is smaller in 2017 because of low survey completion rate. And in addition, the strength of ties between the nodes seems to have increased because the lines are thicker. So now let's look at the data itself. Champlain Valley actually had a weaker social network at the beginning of the Roundtable initiative compared to the other 3 sites. But Roundtable participants appreciated the opportunity to share their programs with each other, and we've been hearing a lot of that feedback qualitatively. And they've had very strong leadership and commitment from participants. So the number of connections per attendee increased from 5 in 2015 to almost 10 in 2016, but then it went back down to 6 in 2017. So similarly, the distance between the participants decreased slightly, which is good, from 2.17 to 1.73 from 2015 to 2017. And finally, reciprocal communication decreased, which actually informs us that in terms of future program development for this region, that there needs to be more increased engagement and back and forth communication and work to foster those reciprocal communication between participants. So the third roundtable location was Florida, and like Champlain Valley, Florida chose to focus their integrated activities on nutrition and physical activity. The meeting took place in Tampa in the Gulf Coast South Florida region, which is highlighted in dark blue on the map. So let's look at what they achieved. Many members of the Southwest Cancer Control Collaborative, the Regional Cancer Control Coalition, attended the roundtable in the second year, and they decided to include collaboration with chronic disease projects as a priority in their 2-year strategic plan. The Florida Roundtable also conducted a training to equip community health workers with tools and knowledge to promote colorectal cancer prevention through healthy eating and increased physical activity. So again, those are pretty good progress on working together. And when you look at the maps, as you can see, it's apparent from just looking at them that the network has become more tight-knit and more connections have been made and the ties have strengthened because the ties become thicker. But you can also see that cancer and chronic disease groups, denoted by the blue and yellow boxes, seem to have separated into their separate corners by 2017. So let's have a look at the data. So as you can see, Florida started off with the weakest network of the 4 roundtables, but managed to slightly increase the average number of connections in the network. And similarly, the distance between the attendees decreased from above 2 in 2015 to below 2 in 2017, which is great. And although reciprocal communication increased from 2015 to 2016, it did go back down again in 2017, which might reflect the anecdotal feedback that we received that the work group activities and leadership were becoming more concentrated to a few people in 2017. So the last location was South Dakota, and the South Dakota Community Roundtable also chose to focus their cancer and chronic disease integration efforts on nutrition and physical activity, but with a special focus on increasing access to resources. The Northeast South Dakota region, for which the hosting the AHEC was responsible for, I've highlighted in brown on the map. And as a caveat, I would say that the Northeast South Dakota AHEC, who was the convener for the roundtable, experienced some instability with their leadership as the director and coordinator stepped down at around the same time in 2015. So due to continued instability, the AHEC and GW mutually agreed to end the roundtables after 2016. So I will show you the available results from the 2 roundtables that were held. So South Dakota Community Roundtable was wanted to, and eventually ended up mapping diabetes prevention programs and local resources across the state. And they collaborated with cancer clinics to increase referrals to the diabetes prevention program. And they ultimately produced an electronic referral policy for clinicians to refer patients to the diabetes prevention program with the state health department, which was modeled after the smoking cessation referral policy. So here are the two social network maps from 2015 and 2016. And it does appear that the cancer professionals in blue are better integrated into the network in 2016 compared to the first roundtables in 2015. So let's take a look at the indicators as well. So South Dakota started the roundtable with a very strong network, only second to the one in Kentucky. And although the average number of relationships per attendee went down slightly from 2015 to 2016, these indicators mirror what attendees had told us, which was that South Dakota public health professionals, whether they work in cancer or chronic disease, have to communicate frequently to keep each other close, especially because there are geographic challenges of working in such a large state that is mostly rural. Average distance between participants went up slightly and communication reciprocity went down. And these numbers likely reflect the challenges South Dakota received with the AHEX leadership influx. And as I mentioned, South Dakota AHEX director and coordinator stepped down between 2015 and 2016. And the position was not filled for 6 months. So that put a significant damper on engagement and implementation of activities. And that could be what is reflected in the social network maps here. So in this way, GW Cancer Center used social network analysis to triangulate qualitative feedback that we received and demonstrate the development of relationships which may be a priority for your cancer control coalition as well. In addition to process outcomes and qualitative feedback from recipients and participants, as well as the observed successes, we were able to use quantitative data from the social network analysis to back up those claims, which is helpful when reporting to funders and stakeholders. We also used social network analysis to monitor project progress and identify areas for improvement and adjust program delivery accordingly. And although we did not do this for the roundtables, social network analysis can also be used to identify missing stakeholders that could make the network stronger, or identify key stakeholders that could help you leverage their connections and influence in the network to further improve outcomes of your program. Social network analysis can also be valuable in these ways to evaluate your cancer control coalition as well. Another thing to keep in mind is that comprehensive cancer control coalitions can choose to assess organizational level collaboration instead of individual level collaboration, as we did here for the Community Roundtable. In fact, organizational level collaboration may help with limiting the effects of new members being added and people leaving the coalition as well, because organizational representation tends to remain pretty constant, even if individual members come and go. Again, social network analysis is a very deep and also evolving method. And the other thing your coalition may want to assess is whether this method is important and feasible for you. So if your comprehensive cancer control program or coalition decides that this is the type of evaluation that they want to pursue and it's a priority, I recommend seeing if your coalition members have this expertise in their organization, because some programs have internal evaluators that could, at the very best, help create instruments and analyze the results and spit out these nice maps and reports for you, but at the very least, they can also provide further advice on ways to move forward and give you directions on whether this method is right for you. So we have produced the Community Roundtable Evaluation Report. It outlines process and evaluation more in depth than what I could present to you in this webinar. And it also highlights some successes and challenges of the program itself. And if you're interested in looking at some of the materials we used for the meetings and for the activities that we conducted in the meetings themselves, they're available in this report, so you can access it by going to that bit.ly link. I also wanted to take a moment to point you to some additional social network analysis resources. The American Evaluation Association is a great resource for more training. They have a bunch of development workshops and have one coming up this year in October in Cleveland, Ohio. I personally attended the Evaluation Association conference last year, and they had a number of workshops dedicated to social network analysis that I've listed here. So I would recommend keeping an eye out for any announcements that might come up as they solidify their agenda and workshop content. And I also know that GW Cancer Center is always assessing for ways and as well as topics on which to provide technical assistance. And if social network analysis is truly a need for technical assistance, please be sure to complete the evaluation poll at the very end of the webinar before you leave, so that you can inform program planning for the future. And here are some additional materials on social network analysis that may be helpful. And again, I think GW Cancer Center is distributing the slides after the webinar, so you can click on the hyperlinks and explore them more on your own. And here are the references. I think they also might be good resources for you to review as well to learn more about social network analysis.
Thank you, Kaneko, for a wonderful presentation. It's very informative. At this time, we'd like to open it up for questions and answers. If you would like to ask Kaneko a question or make a comment, please use the raise hand feature on the right of your screen, and we can call on you and unmute your line. Alternatively, you can also use the chat box or Q&A box on the right of your screen. We already have 2 questions. One was sent via chat from Nikki Campbell. Kaneko, we're going to go back to the slide on communication flow in coalition network. And the question on that was, would an example of who these people would be as follows? For example, organization A would be leadership, organization B would be a communications team, and organization C would be general membership.
Well, Nikki, I'm very impressed with how quickly you have been able to decipher the social network map. Yes, I think that's one way to interpret it. I would say that if you're looking at this network and you have no idea who those are or what those organizations are, I think you can see the types of communication they have and decipher how they work. So you said organization A is leadership.
Right, and B is a communication.
You can see that there's a lot of unidirectional communication happening, a lot of people telling others what to do maybe or giving them direction on projects. And organization B, it could be communication because they seem to have a fairly good outgoing communication channel. And C could be general membership. I mean, they're our complete network, as I've said before, so they're communicating with each other very well. But again, as I said throughout the presentation, you can assess sort of where the gaps in communication might be as well, and I think that's the strength of being able to map out a coalition like this to see where those communication channels could be strengthened, and also for you to identify organizations or individuals that are key in bringing all of those organizations together.
Great, thank you, Kaneko. Our second question is from Brad Richardson. Brad, we're going to take a moment to unmute your line so you can ask your question. Okay, so we just received your question, understanding that you don't have a mic. And the question, Kaneko, is how is dyad reciprocity measured? What would be the equivalent measure in UCNet?
So diet reciprocity, basically, from the survey that you administer, you ask them how often do you communicate to this person, and if the other person says they don't communicate to you, then you can understand then that it's only a one-directional communication method. But if both of you say that you communicate frequently with one another, then you can tell that it's bi-directional. So the indicator itself takes the average of those reciprocal relationships as a ratio of those that are only unidirectional or have no connection at all.
Great. And then another question is from Melissa Chapman-Haney. And do you have suggested resources for doing a social networking analysis to evaluate the value added by participation in the network?
Let me know if I'm not interpreting your question correctly, Melissa. Being able to construct, like we did, a social network indicator of a map that are basically pre and post whatever intervention that you do. So, for example, if you decide at the very beginning of the year that increased integration or better communication is important for your coalition, you can take a baseline approach and administer those surveys up front, and then at the end of the year, see if there are any changes. Hopefully, things have strengthened throughout the year. So in terms of value added, you can attribute basically any organizational or coalition improvements that you may do throughout that year to those changes that you see in the social network analysis and map. Does that answer your question?
We'll wait for Melissa to confirm. Yes, great. Thank you, Hanako. So it doesn't appear that we have any more questions. We'll give it a few seconds to see if we see anything in the chat or see any more hands raised. We have a question on the software. What software is available to conduct social networking analysis?
There are several types of software that can be used to do similar work. GW Cancer Center decided to use UCINet. It's a software developed by Dr. Borgatti that I introduced to you at the very beginning of the presentation. And we determined this because they are a leader in research and analysis for social networks. They do have annual workshops to use social network analysis and use UCINet. It's a very hands-on workshop, so if you're interested, that would be something I look into. But you can also find other lower use software that could be more cost-effective as well. So I would do a little bit of digging to see what works best for your circumstance and your coalition.
Great, thank you. And we do have another question through the raise a hand feature. If you would, you are unmuted.
M. Hargreaves.
You're welcome to ask the question.
I think it's Margaret Hargreaves. I see her question through the Q&A. She's asked, how do you construct a map given that distance is an evaluation measure? So I can go ahead and answer that question. The map is basically spit out through a corresponding software called NetDraw. When you purchase UCINet to input the social network data that you collected through your survey instruments, they have an algorithm that is way beyond my pay grade that spits out some indicators that I showed you today, that the corresponding software called NetDraw also spits out these beautiful graphs for you so that you can see visual representations of your data. So in terms of that distance measuring that distance as an evaluation measure and having that being shown on a map. I cannot tell you what type of algorithm and mathematics they use to calculate that, but from a user perspective, from a practitioner perspective, it's very easy because all you need to do is input the survey data and the software will do the work for you.
Thanks, Kaneko. And just to, if you send a question via chat or Q&A, make sure that you indicate that it's public so that we as facilitators can also see it in case the speaker is kind of working or looking at their slides and not their questions. But we appreciate Kaneko catching that because we didn't see it here. So again, thank you for all your questions. I do have a follow-up from Judy. The question is, it seems like in order to do SNA, you have to be confident that you've identified all partners. What if this is not the case? What happens if a key partner is missing?
That's a great question. Thank you, Judy. So for our circumstance with the community roundtables, we knew who we wanted to analyze because it was a contained network. In other words, we knew we wanted to analyze those who were sitting in the meetings themselves. So we knew up front from registration and attendance numbers who was who and who to expect, that it was a contained network analysis. I know from my brief research with social network analysis that when you're doing more expansive network analysis, some researchers have used the snowball method to ask people to recommend other people or name other people to describe their relationships with them. So your network basically expands as other people mention others who may be partners with them. So in that way, your network expands as people get more references into the network. But that's only useful really if you're doing an analysis that's outside of your coalition per se. If you're analyzing your coalition, hopefully you know who your members are and you can have different criteria to define who you want to analyze within your coalition.
Thank you, Kaneko. Any more questions? We'll give another 30 seconds to see if we see any hands or anything else in the chat box. Okay, hearing none, can I move along? And feel free as I talk through the next two slides to add your questions, which we could address in the next 10 minutes as well. First, I wanted to mention our actionforpsechange.org website, which is a great resource for planning and showcasing policy systems and environmental change initiatives in cancer control. It provides basic information on PSE change approaches, resources, and where to find cancer data and advanced PSE change efforts, and examples of successful PSE change in cancer control. So you may learn from others' efforts, which you'll see on the website. We're always adding new PSE success stories, so please go to the website and submit your own success story. Our cancer control technical assistance staff will be delighted to work with you to build your success story to feature on the website. And we also have, through CDC funding and support, we're going to offer a webinar on our PSE change resource on March 1st at 2 p.m., in which we'll highlight actionforpsechange.org, including an introduction to the 7 steps of the PSE change process, the resource guide that we have, and the corresponding online training available in our online academy. The webinar will include presentations of successful PSE change initiatives delivered by 2 state comprehensive cancer control professionals. For more cancer control technical assistance and educational opportunities, feel free to visit our website at cancercontroltac.org, where you can find free online training, toolkits and guides, partner resources, and announcements for more sessions like today's and webinars. You can also sign up for our monthly e-newsletter, which will update you on exciting training and technical assistance events like this one. So this concludes our webinar. Thank you again to Kaneko, and thank you to all of you for your attendance. Have a great evening.